Hi, good morning. Dr. Garima here. And yes, I'm shooting this video after a long gap. Many things were happening, life happens, and you just get stuck up in so many things. But, anyways, today we are discussing another of Australian Dental Council questions. And I like this question because it will, of course, give you a new perspective and new knowledge. Because as a dental graduate, it's rare that you find a scenario like this because you're posted like for just 1 month in the perio department, and if you are a private college student, then it's very rare to see such a case because not so many patients are there. But if you are in a government college, then in your internship and in your fourth year BDS, because there are so many children, you may have the opportunity to see this. I would suggest you all one thing, all the interns, if you're going to do the internship and just watching this video as to know what lies ahead of you, or you are in a college as a just passed out graduate and just join the college as a fresh assistant lecturer, go sit with the postgraduate students whenever they are doing OPD. There are so many things that you'll find because you'll learn a lot as they are studying more. So because their brain knows more, their eyes can see more, even in the same clinical scenario which you are seeing, which would help you all. But anyways, questions like these can also enhance your scope of knowledge. So let's right away dive into it. I also have to leave for my clinic in 20 minutes. Just so hectic, so busy. Like, I'm grateful, I'm blessed, but yeah, it does take a toll on your health in managing so many things. I need to find helpers more. But yeah, let's go ahead. Okay, this is the clinical appearance of an 8-year-old child brought by his mother to your clinic for consultation. Okay. The mother is concerned about this colored swelling on area. Yeah, so this colored swelling on the area adjacent to the central incisor. However, she states it is not causing any pain to her child. See, whatever words or even letters I would say is given in the question are very important, though it may not seem important to you at the moment. Each word is a key word in a sense that the absence or presence of it also will determine your diagnosis. So the fact that it's mentioned here that it's not causing any pain, that means it's not infected. Always remember, any pain will be always accompanied by some sort of redness, inflammation. You remember those four: rubor, tumor, pallor. You remember it was like in a pathology book in your first year of BDS. So yeah, pain will always be associated with a little inflammation anywhere in the body for that matter, internally or externally. So when something is an external like this and there is no pain, that means it's likely not infected and or not pressing on any important structure. But anyways, looking at this, you can see some bluish discoloration over the place where lateral incisor is supposed to be. If you have studied well and if you have observed such cases, the first look only should give you the diagnosis. Okay, let's see what it can be. What is the clinical diagnosis? Hemangioma, a suspicious hematoma, lymphangioma, eruption cyst, or myogenic granuloma. Okay. Hemangioma. I have opened here pictures of how it may look like. You see this? Now the thing is with hemangioma, this and this can look almost the same. Okay, if this was more blood fluid, it may have looked like this only. But what is the basic difference? This has a tooth present, and hemangioma would rarely be associated with a missing tooth. But an eruption cyst, the name itself says, is associated with eruption of a tooth. So there's presence of a tooth, but it's not there in the mouth yet, like exposed, and the cyst is surrounding it, and then it gets blood fluid filled inside. May look like this, but then because there is a tooth missing, like in the mouth at the moment, I would go with eruption cyst more than hemangioma, because in hemangioma it's occurring in the gums. Hemangioma, the name itself says it's collection of blood in some place, and that is the gums out here, not over the tooth. You understand? And the tooth is present here, so that's a basic difference. So I will eliminate hemangioma. A suspicious hematoma. A hematoma is again a collection of blood in a fluid-filled cavity. It can happen because of trauma, but there is no history of trauma, neither can you see one in the mouth. So I'm ruling out that option. Lymphangioma is somewhat like hemangioma, the same thing. There would be a presence of a tooth in the mouth exposed, not like impacted in the gums like this. Eruption cyst is the right answer. Coming to pyogenic granuloma, it's going to look something like this. Pyogenic granuloma is distinctly red structure where even if you touch it bleeds like crazy, and usually it happens in older people, not like an 8-year-old, and there is presence of a tooth exposed in the mouth. The tooth will not be stuck in the gums, you understand? So yeah, so you can sufficiently and safely rule out pyogenic granuloma, and the answer is eruption cyst here. Now, what is the underlying cause of this condition? Why this happened? You may just tell the parent that this is an eruption cyst and nothing to worry about, and she will ask, but then why did this happen? Well, it's developmental. It just sometimes happens. There is no particular logic behind it. It is not inflammatory because there is no redness, there is no bleeding, there is no pain. It is not infectious because infection, again, see, how will it be infected? For infection, you have to have a bacteria or a fungus or a virus. Otherwise, it cannot get infected. You need some external pathogen, a microorganism to come and infect you, right? And if infection happens, then body is going to try and eliminate it by causing some external symptoms around it, which are inflammation or pain or increase in temperature, nothing like that. The mother specifically said there is no pain, neither can you see signs of any. Neoplastic, odontogenic tumor, okay, very well. Possibility, a rare possibility, especially when you see the lateral incisor is pretty much visible and it looks like an eruption cyst anyways with all the symptoms. Neoplastic odontogenic tumor will have a lot of different symptoms and signs, and you'll have to take x-rays, and there has to be an absence. I mean, there can be a presence of a tooth, but mostly neoplastic tumors will occur in a place which are not so evident in an 8-year-old. It can be usually in the ramus of the mandible or somewhere else in the maxilla. It can also give the same appearance, no doubt, but the possibility is so rare. So you will not jump directly on that rarest thing. You will go on the thing which is most commonly there. Okay, and if the common thing is not satisfying the signs and symptoms and the diagnostic, then you will start thinking of something else. None of the above. None of the above is not an answer because developmental option is there. If developmental option wasn't there, then I would go with none of the above. Okay. The lesion presented in this case is considered as a type of. Considered as a type of, not considered as it is. Okay. It is like a family of that cyst, but not exactly that one. So this is a very good question because it will help you learn a lot more things. So I want you to pause this video, go read about odontogenic keratocyst, dentigerous lateral periodontal cyst, mucus retention cyst, calcifying odontogenic cyst. I want you to read in detail about signs and symptoms of all, because many SBQs have been asked on all these cysts as well, where these are the answers individually. Okay, so all the cysts are very important, not just one of them. So just to give a brief summary, let's go to odontogenic keratocyst. OKC ideally is there when a tooth is missing, because instead of the tooth the cyst developed, there will be always a missing tooth. Usually happens in the ramus of the mandible. It's a very aggressive cyst. Even when you curate everything, and if you leave a little bit of the lining, satellite cysts happen, and you can read more about it. It has to be like surgically excised. Like you can do marsupialization and then enucleation. If it's big, if it's small, just enucleate it completely. The sooner you find it, the better it is. So that's OKC for you. There has to be a missing tooth. Okay, the tooth cannot be present. Now, if a tooth was present here and there would be the neck of the tooth here, then it would be a dentigerous cyst, right? So that's the main difference. In the dentigerous cyst, you will have a tooth and the cyst will be attached to the neck of the tooth. In OKC, there'll be an absolutely missing tooth. Coming to lateral periodontal cyst, as the name suggests, it happens laterally to the tooth. The tooth is present, there is no missing tooth. Okay, so that's a lateral periodontal cyst. Calcifying odontogenic keratocyst or calcifying odontogenic cyst somewhat looks like this. So there'll be a tooth always present. There'll be a cystic formation and that would start getting calcified. Now this kind of cyst is very, very difficult to remove because it's not like a fluid filled bubble, you know, there's actually deposits like, and it becomes like a bone. So you have to drill and drill and drill and you actually don't know where the bone is there and the tumor is there, like very difficult things. Like I applaud all the maxillofacial surgeons and all the surgeons, you know, who do such kind of surgery. It is so complicated and there are so many important anatomical structures present there. So yeah, that is what it looks like. So like I mentioned, go back, read more, take 1 hour, brush through, make important points, understand, see the pictures, you know, visual pictures, the histological pictures, so that each cyst is imbibed in your brain. See how in your family, if you have, say, brother, sister, mother, father, you know characteristics of each one. So if somebody asks you who likes bread, who likes milk, who likes tea, you will immediately say that, right? Take all this cyst as your, you know, known people and learn more about them so you are not confused. And when a question is asked, you exactly know, oh, they are talking about that cyst. I know the features of that cyst, you know. If you study like that, you will enjoy it. If you try to mug up, you're going to frustrate yourself, stress out yourself, not even remember it when the exam comes, and then you'll be like feeling low. I don't know, my answer went wrong, because you're focusing on wrong. I mean, you're studying in a wrong manner basically, but you have limited time, so why not enjoy and study? You know, why stress yourself out? So that is how you take each cyst, make it one of your family members and learn all the details, you know. See pictures about it, be interested in it, you know. So when actually you get, God forbid, any of these patients, I don't want anybody to suffer from this, but in case somebody does and he comes to you, you can rightly diagnose and help them in a right way. If you don't know, how will you diagnose it? And please don't say that I'll refer to the specialist. The specialist is also studying, you know, that's how they know all this. You don't need to have a degree to become a specialist, okay? You need to have the knowledge to become a specialist. So even if you don't have the degree, you can still have the knowledge of specialist and help many people around, you know. So yeah. So the answer here is dentigerous cyst, because it's associated with the neck and the crown of the tooth, the eruption cyst. The rest of the cyst, as I mentioned, don't belong to this description. The most common consequence of this lesion is, okay, now most is the keyword here. Again and again in all my videos I have said, when an adjective like this comes, it means all the options which are given are correct. Do not try to find a wrong answer. You just have to find the most common one, okay? So it's like me saying, if you come late at home, who's the most likely person to yell at you? Would it be your mother, father, brother, or sister? I mean, all of them can yell at you, but who's the most common person yelling at you? You can say probably my mother will yell, or maybe she's sleeping late at night, my father is awake, maybe he will yell. But you will not say brother or sister, they don't care probably, right? They might just ask you where you were, what you did. So yeah, the most common consequence of this lesion is delayed eruption of tooth, because it's just acting as a barrier for it to erupt. So usually what will happen, one day it will become like a bubble, something the child will eat, it will burst. There'll be gross seepage and leakage of liquid, and the parents might get scared and everything will settle and they'll just say, oh, the tooth came out, you know. So something like that. Or or a very rare consequence, blood will start getting accumulated there, and then it will start becoming painful, and probably then you'll have to incise it to break open that cyst. It's basically a bubble, nothing else, and the tooth will be exposed and all the symptoms would disappear, and eventually after 2 weeks it's going to heal back. So that is what is going to happen, nothing much, like not a complication at all having the cyst in the mouth. So the most common. So may delay eruption of the tooth, that's the most common. Bleed persistently, get infected, sometimes turn malignant, are rare consequences that can happen, but we are saying most common, okay? Now, when would you surgically incise this cyst? I would surgically incise this cyst. Basically, I would touch it only if the patient is having fever. It means it's infected. That's it. Otherwise, fear of malignancy, if it's too dark in color, it affects the aesthetics. I don't want to touch it. It's okay, just deal with it. Fear, counsel the patient, too dark in color, it's okay. It's just the blood fluid. You know, sometimes you get hit on the skin. I usually explain this scenario to the patients like this. Imagine this is your skin and you got hit on it. There'll be a bluish bubble there because the blood got collected. And after some time, the skin, because of its elastic nature, it's going to reheal, the blood circulation will resume, and it's going to go back to normal. And most of us human beings who have these bodies have gone through this somewhere or the other as we are growing up. So we know exactly how it is. And we don't care because we know it's going to last for a few days. So too dark in color, we explain the same thing. It's just for some time and it's going to go away, and the patients kind of understand. And since there is no pain, nobody cares. Fear of malignancy, like I said, counsel, affects the aesthetics. Deal with it. Incising it is not going to give any more beautiful appearance. So yeah, you again counsel the patient about it. So I hope this is clear and it was fun. Leave your comments how it was, and hopefully I keep on shooting more videos very often. Preparing the September 2024 questions. Many were repeats, so not so much work, but few were not. So I'm just preparing that. Will be ready soon, and we'll start sharing it here as well. So it helps all the March 2025 candidates. And yeah, let me go back to the clinic now. A long day at work. Have a nice day. Bye bye.